Tikki Pang, thank you very much for joining us on Clearing the Air. If you could just, in maybe 30 seconds, introduce yourself and explain who you are, and then we'll go from there.
Yes, my name is Tikki Pang. At the moment, I'm a visiting professor at a leading academic institution in Asia. But before this, I was Director of Research Policy and Cooperation at the World Health Organization in Geneva, Switzerland, and I retired from there in 2012.
So you spent 13 years at the WHO.
Yes.
When did you first get the impression? When did you first start to believe that there was a systemic problem in its preferred tobacco control policies?
Well, I guess just as by way of background, I got interested in this whole area of tobacco harm reduction quite some time after I left the organization. I left in 2012. It was only maybe just before COVID that someone basically brought to my attention why the WHO is taking this, very tough, inflexible position against tobacco harm reduction and ignoring all the evidence. And I came at it not because I had any particular interest in smoking or in tobacco harm reduction, but because I'm a scientist by training. And I always believe that if there is good scientific evidence that has an important impact on health, that governments should be implementing it, for the sake of the health of the people. And when I saw that the WHO was taking almost an opposite stance and ignoring all the evidence, the scientific evidence, then I decided maybe I would speak up on this anomaly, so to speak. And it's definitely a big blind spot in terms of what the organization is supposed to do, in terms of improving the health of everybody in the world, especially in the lower and lower middle income countries. So that's a background to it.
So you mentioned that it's an anomaly.
Yeah.
And then you mentioned that you were looking into the causes of it. What do you think has caused this anomaly?
Well, I think there are a couple of main reasons. The first one, which a lot of people forget, is that the WHO actually gave birth to the FCTC. So that's WHO's baby. Okay, and as any mother who gives birth to a baby, you would defend that position at all costs. Okay, so they're quite possessive and they don't like any attempt to sort of weaken the framework convention, including acknowledging the potential of tobacco harm reduction. So that's the first. The second one, which I think is fairly well known, is that during the development of the FCTC, big multinational tobacco actively tried to sabotage the whole process. Clearly unethical practices that they were doing during that period, trying to undermine the WHO. Legacy of bad behavior on the part of the tobacco industry. And that translates until today. Anything that comes from tobacco, no. No tobacco companies invited as any part of FCTC deliberations. Neither is any NGO or any organization that is deemed to be sympathetic or funded by big tobacco. And maybe the third issue is pressure from the member states itself. Where I come from, Indonesia, okay, and we have not ratified the FCTC, one of the few countries that have not done so. But the Indonesian domestic tobacco industry is a very powerful political and economic force. And because Indonesia is a member state of the WHO is very aware not to sort of upset the Indonesian government in that sense by promoting anything that could reduce the profits of the tobacco industry. I mean, the reality is that 10% of government revenue in Indonesia comes from tobacco tax. So any move to reduce smoking prevalence is, something that the government just cannot tolerate. And they would support WHO attempts to try to stop tobacco harm reduction.
So in the case of Indonesia, you're saying that they're actively trying to sabotage it in order to sustain the revenue from the tobacco growing industry itself.
Yeah, so three factors, and two former ministers of health of Indonesia, people that I know, one of them was actually my colleague at the WHO, and she explained to me that whenever she went to a cabinet meeting as Minister of Health and tried to push for reducing the prevalence of smoking, not particularly pushing tobacco harm reduction, but just reducing smoking in general, the Minister of Finance will get up and say, do you know that 10% of government income from tobacco tax is part of the government revenue? Minister of Agriculture will say, we have 1 million tobacco farmers. What are you going to do with them if you reduce smoking? Minister of Industry will get up and say, we have 1 million people working in the manufacture of domestic tobacco products. In Indonesia, these are cloth cigarettes called kretek. So the government is not actively trying to undermine, but it has this very strong economic, political interest to keep sort of smoking going. And because the tobacco control lobby is also very powerful in Indonesia, okay, the THR movement has very, very strong opposition. Although I must say, to their credit, the government's taking a fairly laissez-faire approach. Vapes are easily available in Indonesia. Okay, affordability is another issue. But it hasn't gone to the point, like so many other countries in my part of the world, which is actually outright prohibited or banned these products.
But what you're saying there is a little different. You're sort of saying that there is an extent to which Bloomberg and the tobacco industry are on the same side when it comes to at least reducing the availability of reduced risk products, perhaps for different reasons, but they're saying the same thing.
Yeah, but having said that, and as the presentation earlier today mentioned, the Bloomberg sort of influence, it goes beyond just the WHO, okay? It's influencing and funding NGOs, which are strongly anti-THR. It's influencing a lot of media organizations. So it is, I think, a very pervasive and very well funded, let's say, activities on the part of Bloomberg, where the people who are sympathetic and want to fund the promotion of tobacco harm reduction, they just completely outgunned, okay, in terms of firepower. I mean, these guys are investing billions, and it's just a very uneven dogfight, what's happening at the moment.
It brings me back to thinking about the WHO.
Right.
The US has now pulled out. There's very, very serious financial issues within that organization. People wonder, does that create an opportunity for harm reduction? I don't think it does. I think it creates an opportunity for Bloomberg to continue to get his claws in and just make things worse and worse and worse.
Maybe I have a slightly different view to that. If I was a little bit more optimistic, I would say there is an opportunity in the sense that WHO will elect a new Director General next year. And, we have no idea who that person might be, but there's always the hope that whoever takes over from Dr. Tedros will be a little bit more open, especially in times of uncertainty with the pullout of the US and the big hole in funding. WHO has had to reduce by about 30% its staff in headquarters in Geneva. So there is a realignment. But at the same time, I agree with you that could actually provide an opportunity for Bloomberg to actually strengthen its hold even more at the WHO. So a lot of unknowns, but what we're beginning to see is some names that are floating up to be nominated as Director General. I've seen a list of about 12 names, some of them without really in any way saying that they might actually win the race, come from countries which have been very sympathetic to tobacco harm reduction. So if that woman or man becomes elected as WHO Director General, maybe the mindset will be at least a bit more open, a bit more inclusive in terms of being more open to looking at evidence, which at the moment is just completely, it's sort of very ideological, almost emotional. I don't want to hear about it, as opposed to us guys here, which are more sort of advocating for public health.
But just changing the guy at the top, does that really get you there? Because it seems to me that there is a whole issue of institutional capture. Is the WHO as an organization able to self-correct? And if it's not, what does that say about whether or not governments can trust it in other areas?
Well, I'm going to give an answer which may probably be not so objective, okay? Since I worked for the organization for 13 years, I still passionately believe about its importance and its value. Yes, as I mentioned before, they've dropped the ball on this case, okay? But in other areas like pandemic preparedness, I think there's no substitute. There's no other organization that can perform the function of getting countries around the world to come together collectively when there's a pandemic like COVID. But I fully agree with you that changing the guy at the top is not going to be the main issue, okay? But having a leadership which is at least more open to conversation and dialogue is a step in the right direction. But I absolutely agree with you. The only, let's say, stakeholder that can change the WHO are the countries. And I've said this many times in forum. At the end of the day, if countries like the UK, countries like New Zealand, countries like Japan, get a coalition of these countries that can come up to the governing body of the WHO, which is the World Health Assembly, get a bunch of African countries. I know a few of them sympathetic, couple of countries in South America, okay? Get a coalition of about 20, 30 countries, and that's it's not a number I pull out of thin air. I've met with heads of missions of those countries in Geneva who tried very hard at COP11 to get THR on the agenda, to try to get a working group on THR formed. But if
they got nowhere, why would they then?
Because they're fragmented.
Continuing?
Because they're fragmented. So I'm saying, if a country like the UK with strong leadership at the highest level can say, okay, let's get a coalition of 20 countries, and if there are major countries like the UK, okay, leading that kind of thing and demand at the World Health Assembly and at COP, do something about it. That's the only thing that's going to change. It's at the end of the day, you're absolutely right. It's a political organization, okay? And the Director General, who does he listen to? The only person he listens to are the governments, the ministers of health of all the member states, So, I mean, at the end of the day, I do agree that there are people who would say, well, if it dropped the ball on this one, can be trusted on other issues. There are people, I think there's a guy called Tim Phillips who's based in Brussels, who say, burn the house down. Okay. Yes, I mean, my question back to you is, burn the house down. What are you going to put in this place?
Oh, the particular house I was referring to was the FCTC Secretariat. I wasn't referring to the WHO on call, right? When I said that.
Okay.
And I was misquoted on the internet. Having said that too. That's fine. Okay. The internet's fun like that. But I do worry. And I said I said this on the panel with you as well.
Yeah.
What happens the next time the WHO tells me to stay indoors because there's a pandemic? The interaction that I have with the WHO, and this is maybe just me personally, is all negative. And that's the experience of a lot of people, be that in the statements around alcohol that people may disagree with, be that in statements around harm reduction that are just clearly nonsense. There is a set of priorities over here that says commercial determinants to health are the only thing we care about. And then there's actual emergencies where real people want somebody in the WHO to do something tomorrow. And if all we hear 99% of the time is commercial determinants to health, the 1% of the time where it's absolutely critical that we do the thing they're telling us to do, we're going to remember that other 99%.
Okay, well, I'm glad you mentioned it because I've heard criticisms of the organization many times, not just from you, but in many other fora, not just around tobacco harm reduction. And my response has always been, I think there's a lot of misperception out there about what WHO can and what WHO cannot do. You, in your own words just now, you said, if WHO cannot respond by tomorrow, I'm not going to have any faith in it.
In a pandemic situation,
okay, all right,
where they say, you need to stay at home.
Okay.
The question is, given that all of my interactions, that everything that I hear from them publicly, I disagree with them, and not only I disagree with them on are areas that are contested, like harm reduction, right, like lifestyle choices. The one thing that they do that is more important than anything else is around infectious disease control.
Right, right.
But if all I hear about most of the time is lifestyle determinants, what's my impression going to be when they start talking to me about infectious disease?
But lifestyle determinants, Peter, are not the only critical issues during a response to a pandemic. Okay, what about the role of the WHO in mobilization of critical personal protective equipment, for example, masks, oxygen during crisis times? But having said that, I think the other misperception, and this was very clear during the Ebola outbreak in West Africa, WHO is not an emergency response organization. It cannot send 100 doctors, 100 nurses, tons of hospital field equipment around the world in 24, 48 hours. It is not that kind of organization. During Ebola, who were the best responders? It was the militaries, okay, of the US, France, Germany, even China. So what does WHO do? I think the most important role of WHO is setting norms and standards and best practices like the international health regulations, if you like the Framework Convention on Tobacco Control, like codes to prevent pinching of health workers. So it's about setting norms and standards. It's not about emergency response to a pandemic. And you know, the very often quoted vote is from the second Secretary General of the UN, Dag Hammarskjöld, who said, the United Nations did not exist to take us from heaven, to take us to heaven, but to prevent us from going to hell. And I agree. I mean, there are huge criticisms of not just WHO, but the UN organization in general, that it's just a big talk shop, that it is ineffective. I mean, look, just take the Middle East. What has the Security Council done about that? Zills haven't even made a statement. Look what happened in Rwanda in 1994, 1995. You send in this peacekeeping force, they're not allowed to attack unless they were first attacked. So, but at the same time, my response to all of this is, whatever criticism has been leveled at, it provides a platform, okay, especially in the context of global public health, for the poor countries to, and somebody mentioned it today, it is still, at the end of the day, a true democracy. When it comes to a vote on any recommendation at WHO, you know, the United States, 300 million has one vote. The Maldives, 300,000 population has one vote. So it's the only platform for poor countries to have a say. And to me, that's one of the most powerful reasons for its raison d'etre, if you like. You know, yes, of course, the main weakness is that it is hugely political. I mean, whatever happens, the Director General only reacts when Minister of Health calls him. Okay, but you know, I think one of its strengths, obviously, and it's pretty obvious, it's its political legitimacy. It's owned by 194 member countries. It doesn't have any legal powers, unlike the WTO, that can impose sanctions on countries. WHO doesn't have that. It has moral authority.
Yeah,
that's all it is.
And my point is, if it misuses its moral authority so flagrantly as it is doing in this case, and as you agree that it is
right,
doing in this case.
In this case, yes.
It undermines everything else that it does.
Yeah.
But they get things wrong.
Yeah.
Let's look at that statement for a second. There are, if you like to oversimplify it, there are two ways you get things wrong. You do it once by accident and you correct course, or you do it in a systemic and sustained manner. And we're looking at the second one of those things here. And that's what I think is dangerous.
Yeah.
And that is and it bleeds into scientific discourse. People who are sort of mid-career in public health service are scared to speak out simply because of they say that people will say to you privately, look, I agree with you, but I can't say any of this publicly because I'll lose my funding or I'll lose my job or this or that or the other. So it is incredibly culturally pervasive, and it touches more people than we think it does. So I won't ask you again, like, can we trust the organizations? But how can we get people who, the sort of silent majority in public health, who will sort of look at this and go, yeah, actually it kind of does make sense that, we shouldn't make people inhale burning poison if they don't have to?
I probably have a fairly direct response to that question. And I fully agree, when Trump pulled out of the organization, he cited a whole bunch of reasons, including incompetent response to the COVID pandemic, in terms of inefficiencies, in terms of corruption, all these things he leveled at. And I fully agree in the sense that WHO needs reform, absolutely. And in every crisis, like what happened right now because of the 400 million budget hole, it's an opportunity to reform. But what kind of reform? And in direct answer to your question of the silent majority, that's where I believe the key reform should be happening. And that's in the governance of the WHO. WHO was formed in 1948. Who were the players in global health at that time, post-World War II? One stakeholder, the countries, sovereign states. There was no global fund. There was no Bloomberg, okay? So that's the history of the WHO. And it has remained until today. In the meantime, what's happened to global health? It's become so much more complex, so many more players. There's industry, there are the philanthropies, there's civil society, okay? And the whole sort of global health arena is now not just WHO, but has the governance of WHO included this not so silent majority? The answer is no. When I was at WHO, I can tell you there were at least 4 or 5 years in succession where people moved for an agenda item to change the governing structure of the WHO. It was immediately shut down on the first day of the World Health Assembly. We don't even want to go there. Why? The member states cling to their power. It's an issue of sovereignty. They do not want others to be part of the governance. Now, Richard Horton was the chief editor of The Lancet. He was a prime force behind this. And I remember many sort of side meetings before the World Health Assembly. He got together, industry, philanthropies, Gates was there, the big NGOs were there, academic researchers. The problem was they themselves, so-called not-so-silent majority, couldn't even agree on how they would approach WHO. The big sort of opportunity for reform of WHO, number one is governance. It's just monolithic. Now you compare that, for example, to the governance structure of the Global Fund against HIV, TB, and malaria. It's much more open. Industry is there, okay? Civil society is there, okay? So it's much more.
The UN has shown it can do it through the BCC.
Yeah, exactly. So this is the big challenge with governance. And, whether it's going to happen in my lifetime, I'm not really sure, Sovereign states, countries are going to be willing to give up that power of having their only say and not having to deal with the Gates Foundation, with the pharmaceutical industry. Because at the end of the day, global health will not be where it is without the pharmaceutical industry. I mean, 45% of global R&D is spent by the multinational pharmaceutical companies. Look what happened during COVID. Without Moderna, Pfizer, AstraZeneca, 20 million more deaths. So that political hold is really worrying. And it doesn't help that the Director General of the WHO is elected by the member countries. So it's become, as you already mentioned, opportunity for political favors. Okay, I haven't shared this with many people. I was appointed, or I got my position at the WHO without any political support from the Indonesian government. I actually applied for an openly advertised position. So, but I know for a fact that with many other positions, it's the Minister of Health calling the Director General and saying, oh, by the way, I'm retiring in a year. You got something for me in Geneva. I mean, for many low middle income countries, UN position in Geneva.
Just low middle income.
Oh my goodness. So there are these perverse incentives, if you like, and sometimes it ends up with an appointment which is, totally inappropriate in terms of technical ability, in terms of experience. So that's, I would say nepotism up to a point is still going on. Even this with many UN organizations in general, So yeah, I mean, burn the house down.
Well, I mean, just the last point.
Okay.
You're talking about a reform to the government structure
Yes.
of the WHO that's more inclusive. But isn't that what the FCTC convention's already done? They've essentially brought in their favoured sons. It's got its own nepotism. It's got its own list of participants, 80% of whom are financed by Bloomberg Philanthropies.
Exactly.
And they won't let anybody else in. So if you're saying, are you saying that we should reform the entire WHO's governance structure to make it look more like the Framework Convention on Tobacco Control? Because that doesn't seem like a good idea to me.
Yeah, I don't think that's a good idea. But I think in terms of the conference of the parties, right? Yes, absolutely. Those organizations that are sympathetic to the WHO position, they're invited, they can participate, they can make statements. But when it comes to the actual voting, it's only the member states that have that power. And it's the same with the World Health Assembly. So if the reform in the first instance allows organizations like yours to be in official relations with the WHO, that would be a step forward. It enables you to go to the World Health Assembly as an official NGO or whatever it is, to be in official relations, to make statements, okay? But whether or not that will translate to having an actual vote, I think that's very unlikely. But that would be a first step in the right direction, because, I used to be in charge of NGOs that apply to be in official links with the WHO, and it was very clear to me, any NGO that's affiliated with the tobacco industry, with the arms industry, automatically say no. And this is when I was there, so it's well before tobacco harm reduction. Any organization that's related to tobacco or arms, we don't even consider admitting them to be in official relations. But yeah, I mean, what's happening in the Middle East, all this turmoil, huge opportunity, and we'll see what kind of, it's going to be really major reform to make it happen. But it's, at the end of the day, maybe driven by economic necessity. I don't know who's going to plug the hole in the funding of the WHO. China is sort of doubled its contribution. I think the Gulf states are going to do the same. Okay, I'm going to bet you that in 1-2 years' time, the US is going to rejoin.
I probably agree with you on that. Yeah, I suspect the US will wake up with a massive hangover and wondering what the hell it did while it was drunk, Thank you so much. That was amazing.
Well, I hope I wasn't obfuscating my replies.
No, you very much were not.
Yeah, okay. Because, sometimes I get a little bit defensive, maybe, with the WHO.
Okay.
But
I mean, look, it's difficult